Again, when working in the hand clinic, certainly the most common diagnosis, besides the trigger finger, the basilar joint arthritis, carpal tunnel syndrome, is certainly Quervain's tenosynovitis. Comprised of the two tendons that pass through the first dorsal compartment is the abductor pollicis longus and the extensor pollicis brevis. I call it the cousin to trigger finger, where you have an inflammation of the extensor sheath that passes through, that in a sense inflames and enlarges, and it basically causes friction at the first dorsal compartment, quite painful. If you had one option to treat this common problem, you certainly want to use any type of bracing system, splinting system that will actually incorporate limitations of the thumb, allowing free motion at the IP joint that basically immobilizes the wrist and the MP of the thumb. The reason for this is this prevents that tendon from going back and forth underneath that particular sheath, causing that friction to exist. And in early stage cases, typically non-steroidal anti-inflammatories with splinting, if you're going to treat them in clinic, certainly any of your modalities that increases blood flow to that area, massage. Some people will perform isometrics there to prevent any atrophy. I find that to be optional. Will do very well in a conservative management. From a standpoint of surgical management, though, once the patient will, and again, this is also very similar to trigger finger, they'll have an injection of corticosteroid. If those all fail, then the options are to release that first dorsal compartment. That allows for freedom of the tendon and the inflamed tendon to pass through without promoting that inflammation or irritation. In that case, you're now going to add on to your treatment protocol edema reduction in that area. Still going to use modalities, massage, soft tissue mobilization. Also, in this perspective, you're going to consider scar management, which typically scar gel is ideal. I do have many of my colleagues are very, very much in favor of using ultrasound, which I happen to agree, especially for this condition because it's so superficial.